Welcome to today's deep dive, where we're going to be looking at two eye conditions. I'm sure you've heard of them, cataracts and diabetic retinopathy.
Yeah.
And to help us kind of get through this, we've got some nursing study guides, which are really great because they give us a clear, concise overview of both of these. It's like a cheat sheet to understanding what's going on. So have you ever stopped to think about what's actually going on inside your eye when these conditions develop?
Yeah, it really is pretty remarkable when you think about, how something like sunlight or blood sugar can have such a dramatic effect on our vision.
Right.
Yeah.
So let's start with cataracts. I love how one of the guides puts it. Cloudy cataracts cause cloudy vision. It's such a simple way to just explain that buildup of protein
Right.
in the lens of your eye, making it cloudy and blurring your vision. It's like trying to look through a foggy window, But when the lens is healthy, how does it actually work?
Well, you can think of it as like your eye's autofocus system. The lens focuses light onto your retina, which is the part at the back of your eye
Okay.
that sends signals to your brain so you can see clearly. But when that lens gets cloudy, that focus gets disrupted, and that's what leads to all sorts of vision problems.
Yeah, the study guide, it actually mentions faded colors, halos around lights, even double vision
Wow.
in one eye. Can you imagine?
Yeah, no, it really highlights how much we depend on clear vision for just about everything we do.
Right.
And what's so fascinating is that some of the biggest risk factors for cataracts are actually things that we can control.
Oh, interesting.
Age is a factor, sure, but smoking, too much sun exposure, and even poorly managed diabetes can
Right.
really increase your risk. In fact, one study showed that smokers are twice as likely to develop cataracts compared to non-smokers.
Wow. That's a pretty compelling reason to either avoid smoking or kick the habit if you haven't already. It's interesting, though, the guide really emphasizes that cataracts themselves don't cause any pain.
Right. And that's a crucial point because pain is usually a warning sign that something's wrong. But with cataracts, the vision loss happens so gradually that you might not even notice it until it's pretty advanced. This is exactly why those regular eye exams are so important, especially as we get older.
Yeah, and speaking of treatment, the guides are pretty clear that surgery is the only way to actually get rid of cataracts.
Right.
And they describe this procedure called phacoemulsification,
Mm-hmm.
which sounds pretty intense when you say it out loud.
It might sound intimidating, but it's actually a very common and effective procedure. They use ultrasound waves to break up the cloudy lens,
Wow.
and then they gently remove it and replace it with an artificial lens to restore clear vision.
So you're basically getting a brand new lens for your eye.
Exactly. Pretty cool, huh?
That is incredible. The guides also mention that this type of surgery is minimally invasive and that recovery is usually pretty quick.
Yes, exactly. Most people will see a big improvement in their vision within a few weeks. Of course, any surgery has some level of risk, but cataract surgery is generally considered very safe, and the success rates are high.
Okay, so we've covered cataracts, but now let's shift gears and talk about diabetic retinopathy.
Okay.
As the name suggests, this one's directly linked to diabetes. And the guide doesn't mince words. It says straight up that diabetic retinopathy is a leading cause of blindness.
It's a very serious condition, no doubt about it.
Right, yeah.
Essentially what happens is that high blood sugar damages those tiny blood vessels in the retina. Can you explain a bit more about how that damage actually happens?
Sure. High blood sugar levels over time can weaken the walls of these tiny blood vessels.
Mm-hmm.
This can cause them to leak fluid, swell, or even close off completely, and that deprives parts of the retina of the oxygen they need to function properly.
Exactly. And as the condition progresses, it can even lead to the growth of abnormal and very fragile blood vessels.
Oh, wow.
The guide classifies diabetic retinopathy into two main types, non-proliferative and proliferative retinopathy.
Okay, so non-proliferative is like the earlier stage, where the damage is less severe. But if it's not managed well,
Right.
it can progress to the more serious proliferative stage.
That's right. The guide really emphasizes that the complications become increasingly severe as the disease progresses.
One symptom that really stuck with me was this mention of a curtain-like shadow over vision. Can you imagine what that would be like?
Yeah, that would be terrifying to experience that kind of visual disturbance.
Right.
And it really highlights how important it is to seek immediate medical attention if you have diabetes and notice any sudden changes in your vision. But, here's the good news. Cataracts, diabetic retinopathy is often preventable, or at least manageable,
Right.
with early detection and proper treatment.
The guide actually has this really catchy memory trick, the 3 C's. Control sugar, check eyes, cut smoke.
It's a simple way to remember the key steps in managing this condition. Meticulous diabetes management is crucial. Regular blood sugar monitoring, keeping A1C levels within a healthy range, that's a measure of your average blood sugar over time, and working closely with your doctor can make a world of difference.
Yeah, so it's really about taking a proactive approach
That's
to managing your diabetes
Yes,
to prevent these complications from developing in the first place.
exactly.
And it seems like those regular dilated eye exams, those are really crucial too, right?
Yeah.
The guide mentions that this allows the ophthalmologist to actually see the back of your eye
Yep.
and spot any signs of damage early on.
Absolutely. Early detection is key when it comes to preventing vision loss from diabetic retinopathy. And even if the condition does develop, there are effective treatment options available, like laser photocoagulation and injections of medications called anti-VEGF agents.
Okay, can you break down how those treatments work? Because they sound kind of intense.
They might sound complex, but the principles are fairly straightforward. Laser photocoagulation uses a highly focused laser beam to seal off leaking blood vessels
Okay.
and prevent further damage. It's kind of like cauterizing a wound.
So it's like a targeted approach to controlling the bleeding and preventing that further damage to the retina.
Exactly. And then there are anti-VEGF injections. VEGF stands for vascular endothelial growth factor,
Okay.
which is a protein that promotes the growth of new blood vessels.
Mhm.
In diabetic retinopathy, these new vessels are often abnormal and fragile, so these injections help to block that process.
So it's like they're specifically targeting like the root of the problem.
Yeah.
The guides also emphasize the importance of like teamwork in managing diabetic retinopathy. It's not just about seeing your eye doctor, but also working closely with your primary care physician and endocrinologist
Right.
to manage your diabetes effectively.
Precisely. It's a multidisciplinary approach. Ultimately, controlling your blood sugar levels is the most effective way to prevent or slow the progression of diabetic retinopathy.
Right.
And that requires a coordinated effort from your entire healthcare team.
Right.
And of course,
It's a good reminder that we're not alone in managing our health.
Yeah.
There are resources and experts to help us along the way.
Speaking of resources, I think it's worth highlighting that the guide mentions fluorescein angiography
Okay.
as a diagnostic tool for diabetic retinopathy.
What exactly is that? It sounds a bit intimidating.
It's actually a very useful imaging technique that allows ophthalmologists to see the blood vessels in your retina in great detail.
Okay.
They inject a special dye into your arm,
Mm-hmm.
and then they take pictures of your eye as the dye travels through the retinal blood vessels.
Oh, wow.
This helps them to identify any areas of leakage, blockage, or abnormal vessel growth.
So it's like creating a roadmap of the blood vessels in your eye
Exactly.
and showing exactly where the problems are.
Exactly. It allows for much more precise diagnosis and treatment.
That's incredible.
The guide also mentions another advanced imaging technique called optical coherence tomography, or OCT.
Oh, I've heard of that one. What does that do exactly?
OCT uses light waves to create cross-sectional images of the retina. It's incredibly detailed and allows ophthalmologists to measure retinal thickness, identify areas of swelling, and track changes over time. It's like getting a high-resolution scan of the back of your eye.
So they can see like everything.
Pretty much.
It's amazing how much information they can get from these non-invasive techniques. Technology has really revolutionized how we understand and treat eye conditions.
I completely agree. It's remarkable how far we've come.
As we're going through this deep dive into cataracts and diabetic retinopathy, it just makes me think about all the things we often take for granted,
Yeah.
like our vision and like how important it is to protect it.
It's true. We rely on our sight for so much. Everything from enjoying a beautiful sunset to reading a book to simply navigating our surroundings.
Yeah.
It's a sense that truly enhances our quality of life.
And one thing that stood out to me in the guide is that although these conditions can be serious, there are things we can do
Right.
to proactively protect our eye health.
That's a great point. Regular eye exams are a must, of course, but even just making healthy lifestyle choices like not smoking, maintaining a healthy weight,
Yeah.
and managing your blood sugar if you have diabetes
Right.
can significantly reduce your risk.
So it's about like taking ownership of our health
Absolutely.
and being informed about the choices we make.
Exactly. And remember, eye health isn't just about seeing clearly. It's a reflection of our overall well-being.
Going through these study guides has really been an eye-opener for me. It's made me realize how much I still don't know about eye health and how much there is to learn. For instance, the guide briefly mentions different types of eye drops used for cataracts, both before and after surgery. I'm curious, what exactly do these eye drops do?
Well, they serve various purposes depending on the stage of treatment.
Okay.
Before surgery, for example, they might use drops to dilate your pupils, which makes it easier for the surgeon to see the lens clearly. They might also use drugs to help prevent infection.
Okay, that makes sense. And what about the drops used after cataract surgery?
The postoperative drops usually include antibiotics to prevent infection and corticosteroids to reduce inflammation. It's all about promoting healing and minimizing any potential complications.
It's fascinating how much science and precision goes into the care of our eyes, even down to the types of eye drops used.
It really is, and it speaks to the incredible advancements we've made in ophthalmology. We have so many tools and techniques at our disposal to help preserve and enhance vision.
While we're on the topic of advancements, I noticed that the guide mentions the use of artificial tears for dry eye. I've always wondered how those actually work.
Dry eye is a common condition where your eyes don't produce enough lubrication, which can lead to irritation and discomfort. Artificial tears are designed to mimic your natural tears and provide that much-needed moisture.
So they're essentially providing like supplemental lubrication to the eyes.
Precisely.
Oh.
They help to soothe the eyes, reduce irritation, and improve overall comfort.
Okay.
There are various types of artificial tears available over the counter, each with slightly different formulations. It's a good idea to talk to your eye doctor about which type might be best for you.
It's amazing how something as seemingly simple as eye drops can play such a significant role in maintaining our eye health.
It's a reminder that even small interventions can make a big difference when it comes to preserving our vision.
You know, going through these study guides has really highlighted the importance of having a good relationship with your eye doctor.
Absolutely.
They're the experts who can guide us through these complex topics
Right?
and ensure that we're getting the best possible care.
I couldn't agree more. They're our partners in protecting our precious sense of sight. They can answer our questions, address our concerns, and help us make informed decisions about our eye health.
It's a reminder that we're not alone in this journey.
Yeah.
You know, we have resources, experts, and a wealth of knowledge at our fingertips.
And the more we understand about these conditions, the better equipped we are to advocate for our own health and make informed decisions.
Right.
So what stands out to you as the most empowering takeaway from all of this information?
I think for me, it's realizing that we have more control over our eye health than we might think. Through healthy lifestyle choices, regular checkups, and, proactive management.
Yeah.
We can significantly reduce our risk of developing these conditions, or at least slow their progression. It's not about living in fear of vision loss, but rather taking proactive steps
Right.
to protect our sight and maintain our quality of life.
I love that perspective. Knowledge truly is power. The more we learn, the better choices we can make.
Absolutely. And speaking of learning, there's still so much more to explore in these study guides.
Oh, yeah.
For example, I'm curious about this section on low vision aids. What can you tell us about those?
Low vision aids are devices and strategies that can help people with vision loss maximize their remaining vision and maintain their independence.
Okay.
They range from simple magnifying glasses to more sophisticated electronic devices that can enlarge text, enhance contrast, and even read text aloud.
So there's essentially tools that help people with vision loss navigate their daily lives more easily.
Exactly. They can help with tasks like reading, writing, watching TV, and even recognizing faces.
It's remarkable how technology is being used to empower people with vision loss and improve their quality of life.
It truly is, and the advancements in this field are constantly evolving.
Right.
It's inspiring to see how innovation and human ingenuity are being applied to address the challenges of vision loss.
Speaking of challenges, the guide also mentions the emotional and psychological impact of vision loss.
Right.
That's something we haven't really touched on yet.
You're right. Vision loss can have a profound impact on a person's emotional well-being. It can affect their confidence, independence, and overall sense of self.
Yeah, it's a reminder that we need to approach this topic with sensitivity and understanding. It's not just about like the physical aspects of vision loss, but also the emotional and social implications.
Exactly. And it's important to remember that there are resources and support systems available for people experiencing vision loss.
Oh, that's good.
There are support groups, counselors, and therapists who can help individuals cope with the emotional and practical challenges.
That's reassuring to know. It's important for people to feel supported and connected during what can be a difficult and overwhelming experience.
Absolutely. And it's important to emphasize that vision loss doesn't have to define a person's life.
Right.
With the right support and resources, individuals can adapt, thrive, and continue to live fulfilling lives.
I love that message of resilience and hope.
Yeah.
It's about focusing on what's possible rather than what's lost.
Exactly. And that's something we should all keep in mind, whether we're personally affected by vision loss or simply want to be more informed and supportive of those who are.
We've covered a lot of ground in this deep dive,
We have.
but I feel like we've only just scratched the surface of this vast and fascinating topic.
I agree. The human eye is an incredibly complex and remarkable organ, and there's always more to learn and explore.
It's inspiring to see how medical knowledge and technology are constantly advancing to improve our understanding and treatment of eye conditions.
It truly is. And it gives us hope for the future. As we continue to unravel the mysteries of the eye and develop new therapies, the outlook for people with cataracts and diabetic retinopathy is brighter than ever.
That's a wonderful thought to leave our listeners with. And speaking of listeners, I think it's time for us to wrap up this part of our deep dive and take a quick break.
Sounds good. We'll be back soon to share some final thoughts and reflections on this fascinating journey into the world of eye health.
Welcome back. We've been on quite a journey exploring cataracts, diabetic retinopathy, haven't we? It's amazing how much we've unpacked just from these nursing study guides.
It really highlights how much information is out there and how important it is to have those reliable resources to help us make sense of it all.
Speaking of resources, I was really struck by how much the guide emphasized the role of nutrition in eye health.
Oh, yeah.
It's not just about medications and procedures. It seems like what we eat can actually make a difference.
Absolutely. The guide specifically mentions antioxidants like vitamin C and E,
Okay.
which can help protect our cells from damage. And there's actually been some really interesting research on the role of these antioxidants in cataract prevention.
Oh, can you give us an example?
Sure. One study found that people who consumed higher amounts of vitamin C had a lower risk of developing cataracts.
Interesting.
It seems like vitamin C's antioxidant properties helped protect the lens of the eye from damage caused by free radicals.
So, eating plenty of fruits and vegetables rich in vitamin C could potentially help protect our vision.
That's the idea. And don't forget about vitamin E. It's found in foods like nuts, seeds, and leafy green vegetables. Another study showed that people with higher levels of vitamin E in their blood had a slower progression of age-related macular degeneration.
Wow. Okay, so vitamin C and E are important.
Mm-hmm.
What else should we be thinking about in terms of eye-healthy foods?
Well, the guides also highlight lutein and zeaxanthin.
Okay.
These are powerful antioxidants found in leafy green vegetables like spinach and kale, as well as eggs. They're particularly concentrated in the macula, the central part of the retina responsible for sharp, detailed vision.
So, those foods are like a targeted defense system for the most crucial part of our retina.
Exactly. And then there are omega-3 fatty acids.
Okay.
You find them in oily fish like salmon and tuna, and they seem to play a role in maintaining the health of the retina and might help reduce the risk of developing age-related macular degeneration.
It's amazing how interconnected everything is. What we eat doesn't just affect our overall health, it directly impacts our vision too.
It's a great reminder that a healthy lifestyle is truly the foundation of good health, including eye health.
As we wrap up this deep dive, what would you say is the most crucial takeaway for our listeners?
I think for me, it's that empowering message that we have more control over our eye health than we might realize. By making informed choices about our lifestyle, our diet, and our healthcare, we can significantly reduce our risk of developing these conditions, or at least slow their progression.
And it's about being proactive, right? Scheduling those regular eye exams.
Absolutely.
Even if you think your vision is fine.
Early detection is key. It's much easier to manage these conditions when they're caught in the early stages.
If someone listening is concerned about their eye health, or maybe they've noticed some changes in their vision, what would you advise them to do?
The first step is always to talk to your eye doctor. They can assess your individual situation, answer your questions, and recommend the best course of action. And remember, there's no need to panic. Knowledge is power, and there are resources and treatments available to help.
It's about feeling empowered to advocate for your own health and seek out the information and support you need.
Exactly. And remember, even if you have been diagnosed with cataracts or diabetic retinopathy, it's not the end of the story.
Right.
There are effective treatments available, and with the right care and management, you can maintain your vision and quality of life for many years to come.
That's a really hopeful and encouraging message to end on. We've learned so much about cataracts and diabetic retinopathy, and I hope our listeners feel empowered to take charge of their eye health.
I agree. It's been a fascinating exploration, and I hope it inspires everyone to take care of their precious gift of sight.
Thanks for joining us on this deep dive. Until next time, keep those brains engaged and those eyes healthy.